Hello, this is Ty Newell, and this is COVID status report number 5 with data as of April 3rd, and today is April 4th. I'm hoping sooner rather than later to bring good news, but as of April 3rd, and as I've looked at continuing trends today, the US continues on a path that is unacceptably high. I don't understand the nonchalance and lack of urgency on the part of our national and other leaders. It seems like we're laying in a road with a steamroller heading at us, and there's no one in charge. And so it's just very painful to watch this. But as we've discussed, regardless of the situation in your local community, you can protect yourself and those around you if you take this seriously. As we look at the trends of other countries, and as we'll see, France is now deviating and going back to what looks like accelerated spread of the disease. Perhaps it's the way the data has been collected. We'll discuss that more. But we for sure can see Italy doing much, much better. Spain starting to do better, but still it's just a difficult struggle. And Iran as well, looking like they are managing better, while the UK, similar to the US, although a bit behind us in time, so they have time to keep from moving along the path we're on, that they also need to figure out how to get on a better path. I was in contact with a friend in Turkey. I've been to Turkey many times, and it's a wonderful country. Istanbul is one of the most beautiful cities in the world, situated like New York and San Francisco on a great waterway. And this company Arçelik, who I've worked with for many years, a major appliance manufacturer. They build probably some 20,000 major appliances each day. They have gone into high-speed development with some partners on a emergency ventilator, and they expect by the end of April to be in production, releasing 1,000 by that time, and then several more thousand as they move into May, with the intent to distribute the ventilators to other countries as well as meeting Turkey's needs. And so I applaud them very much. And you can see a picture from their website. And if you just simply do a web search for Arçelik and ventilator, you'll kick up some different news articles on that. So while Turkey is having great difficulty getting the infection spread in control, they're very actively working to do that, but they have a very significant challenge ahead of them. And as you see in this workplace where several engineers are working to develop this ventilator technology, they're all wearing masks. And so they are taking it seriously, and I hope they get things on a better path. So here's the infections parameter, that parameter that roughly describes if you have an infection and each day for 14 days that you're infected, if you meet somebody new who's susceptible and you give the infection to them, that would be a parameter of about 14. And as we have seen, that getting this parameter down to a level about 2 is where the recoveries can start to outpace the infections, and where medical facilities are not so strained. And if we get it down to 1, then we're winning the battle. but hanging around at a level of 6, 7, or 8, or 14, or 50, or more is just going to spread this thing like wildfire. With France, I don't know if it was a reporting of the data, but there seemed to be a lag of data, as I previously mentioned, and then all of a sudden a large jump in data. And so I don't know if they've been having difficulty with tests as well as the caseload, but I smoothed 3 of the data points between the two that are shown. And it appears as if France is on an upward trend, and I hope that they get it back down because they had been in a level similar to Germany. Germany continues to look like they're starting to stabilize and maintaining a level of infection parameter less than 4, and hopefully then start marching down toward 2. And Spain is marching down, Iran is marching down very nicely. And again, we still can't be sure until more data continues to come out. But these are the trends that I hope we start seeing in the UK and the United States. South Korea continues to maintain a level of about 2. So we said it's just like a forest fire that just won't go out. You have to keep stopping and stepping on it. But when you can get down to a level of 2, you can go to where instead of everybody isolating, to where now you have enough resources to hop on those infections as they appear, quarantine and separate anybody with an infection or that's been associated with someone that has an infection, and keep control of it. But at a level of 6 as being displayed by the United States, that just is not happening yet. So as far as our first, second, and third place, South Korea is number 1. Italy is right there with them. And Spain is coming down nicely, and Iran is close by. And Germany's looking quite good too. When we look at this logarithmic plot and then look at the path that we started around here, and as I mentioned, the path was given, so this is a prediction model I've put together based on the simple exponential growth characteristics and using this infections parameter. And if we stay on the path of 7 infections per infected person, we will follow this red line. It looks like the US, if they continue, are going to be somewhat lower with an infection parameter of 6, but still one that over the course of the next month takes us to about 10 million infections. And as I've been using a 1% fatality rate, it's looking like that is low. It's looking like it's going to be more like 1.5, 2, or possibly even 3 as we see how strained our medical resources become. But that means that following this red path, and again, it's something we can avoid. Following this red path is going to be 100 to 200 to 300,000 fatalities. And the simple act of isolating, wearing a mask, taking this seriously, getting us down to an infection parameter of 1.5 to 2. And again, that means if you are infected and whether you feel sick or not, but you're spewing viruses, that over the course of that time that you have that infection, that you're only infecting 1.5 to 2 other people. This is different than the R0 or R0 basic reproduction factor you hear about. This is, to me, a more realistic number of what happens over the course of the illness. And these 4 to 5 data points that have been plotted, they're following this predetermined path, since we have an incubation period of about 5 days, And as of the data tomorrow, we'll see if it keeps following this path, but I fully expect it to. And then the proof of the pudding, are we starting to take it seriously as a whole throughout the country? Or are we simply going to watch what's happening in New York, New Jersey, and elsewhere as if it's a reality show? Whether we're going to move up in this direction or start turning the curve and get over on these paths. And if we turn the curve here, that's great, but still we're getting up to 500,000 or more. It's time to get serious now. This picture over on the right is from a park in a small community in central Illinois. Gathering of some young folks there, obviously not taking it seriously. But when you have leadership that says that there's guidelines that recommend wearing a mask, but that they are not going to wear a mask, what kind of leadership is that? Of course, that's none. It's like a general telling the troops to charge up a hill and they're going to just sit back and watch and see what happens. This is foolishness and we need to take it seriously, but we have to take responsibility for ourselves. So regardless of what you're hearing from others who are not taking it seriously, do the right thing. Don't gather. A gathering of 10 is not acceptable. A gathering of 5 is not acceptable. Stay in your family or household unit, and then simply designate one person to go out for the essential needs now and then. But take this seriously and wear a mask. Now, I mentioned the video by Lydia Beruiba from MIT. And here's me not coughing or sneezing, because in order to see this cough cloud or sneeze cloud, you need a very high intensity light. You need to be able to use that to configure that into a sheet of light. And then you need high-speed photography to make the droplets visible. But here I'm doing my best to simply spit. And where I'm standing and in that furthest circle is about 16 feet. I'm not a very good spitter. My brother and my friends and I, and not recommended, especially now, but really never. We used to get into spit fights. You'd stand about 10 feet apart and you couldn't move your feet. You could kind of dodge it and you'd take turns hurling loogies at each other. And unfortunately, I was never very good at forming a loogie to hit my opponent. But anyway, I'm just trying to demonstrate that you can definitely expel fluids from your mouth much, much further than 6 feet. So I don't know why that is the separation distance. Get further away. From Professor Beruiba's video, 20 to 30 feet for this cloud of microscopic loogies that's about half the length of an aisle at Walmart. So somebody simply walking by the aisle, coughing and sneezing down your way while you're looking at fishing lures. That wafts through like a smoke ring from someone. It stays as a contiguous cloud and passes by you. You can get infected that easily. Now, I had shown some state data, and I'll continue taking a look at that. Here's data for New York, which is the dominant place of infections. But as we look at the infection parameter for New York, and because New York has such a large level of infections, the data is smoother than in states that still have time to take corrective action, but may not be taking things so seriously, along with Washington, Georgia, and Illinois. And of course, New York and Washington led the nation in early infection cases. And Washington is doing an excellent job in moving down to a level of about 2. New York is steadily improving, and those states, relative to states like Illinois, which still has much improvement to go, and then Georgia, where things are a bit choppy and they're maybe a little late to taking things seriously, but and their data because of that is a little more noisy. But hopefully, we're going to see good trends in those states as well as many, many others throughout the nation. But right now, this overall U.S. infection parameter of about 6, it's made of places like New York and Washington, which are getting it under control. As horrific as things are in New York, they should be starting to feel some, not relief, but at least that people are recovering at a rate relative to what's coming in as new infections, are getting to a manageable level, but still it's critical there. While Georgia and Illinois, we have time, but we can't waste another moment getting prepared for this wave moving through. Here's a picture of my brother. He fashioned a mask out of a sweat sock. Now, you can tell he got the good hair in the family, and I kind of got the short end of it. Now, Todd wouldn't tell me whether or not he washed this sweat sock mask, and so I don't have that level of detail. But I thought this was quite clever because inside of the sock, he's able to put a piece of paper towel, and then he made a tie that goes behind his head. So whatever type of elastic or shoestring or something like that to hold it in place, and then throw it in the washing machine, take the paper towel out, wash it under sanitary conditions, and then you're good to go again. Add a new paper towel, and you've got, as we've talked about, this is not to protect you from others. It's to break up that sneeze and cough cloud and to minimize the amount of droplets that you're spraying out. And we've known this forever. 1918, you would get a fine if you did not wear a face mask. So we've known forever that this is an effective way to knock down the amount of infectious particles that we're spreading. And so anyway, thank you very much, dear brother, for giving us another idea on how to protect ourselves and protect others. And as we've said before, stay home. And then thank you, all essential workers and medical staff who are risking yourselves and putting yourselves on the line to take care of us. Goodbye.